Welcome to the deep dive. Today we're getting into a health topic that, well, frankly affects almost every single man as he gets older: benign prostate enlargement, or BPH.
That's right.
Our mission here is to really unpack what BPH actually is, how surprisingly common it is, and how things like your ethnicity can even influence prostate size.
And how we measure it, importantly.
Exactly, how it's measured, and crucially, when treatment actually becomes necessary. We think this info can genuinely empower you.
Yeah, the goal really is to cut through some of the noise, maybe the information overload, and give you clear, actionable insights.
Okay.
We want to connect these maybe technical-sounding details to the bigger picture of men's health, so you understand not just what we're talking about, but why it matters for you.
Okay, so let's unpack this then. BPH, it's the non-cancerous enlargement of the prostate. Seems like a natural part of aging, right?
It is, largely, but the stats are pretty striking.
Yeah, I saw those. We're talking maybe 8 to 20% of men in their 40s, jumping to 50% by age 60, and then 80 or even 90% by age 90.
It's huge. Globally, that was 94 million cases back in 2019, and it's climbing fast.
And the key thing, we have to stress this, BPH is not cancer.
Absolutely. That distinction is critical. Now, what's fascinating here is why this natural growth causes issues.
Right, the symptoms.
Exactly. The prostate grows continuously, maybe 2 to 2.5% per year after 40, and because of where it sits, wrapped around the urethra.
The tube carrying urine out.
Precisely. It starts to squeeze it, like a clamp.
Ah, okay.
And that leads to those, bothersome symptoms. Difficulty starting, maybe a weak stream, getting up multiple times at night. That's nocturia.
The nighttime trips, yeah. Very disruptive.
Very. And that feeling of not quite emptying your bladder fully. Imagine, waking up 3-4 times every single night. That's the reality for millions.
So it really highlights how impactful this seemingly, natural process can be. So when we talk about normal prostate size, what does that even mean? Is there a standard?
Well, typically is the word. Typically around 20 to 25 grams. Think walnut-sized, maybe 4 by 3 by 2 centimeters. Volume-wise, 15 to 30 cubic centimeters.
Okay, walnut-sized. But here's where I found it gets really interesting. The ethnic variations.
Yes, absolutely. This is often overlooked. Your ethnic background plays a significant role.
How so?
Well, for example, African-American men often tend to have larger prostates. They might also experience more severe BPH symptoms.
In yet your way.
Potentially linked to maybe higher levels of testosterone in an enzyme called 5-alpha reductase. But it's complex.
Okay.
Then, on the other hand, you see Asian men generally showing a lower prevalence of BPH.
Wow.
And you even see huge differences within, say, the same country.
Yeah.
There's a study in the DRC, the Democratic Republic of Congo, where Lega men had a median volume around 55 cc, but Havu men were closer to 20 cc.
That's a massive difference.
It is. Migration patterns can even influence this over time. So the clinical takeaway is normal is really quite individualized.
That really changes how you think about averages, doesn't it? So given all that variation, how do doctors actually measure the prostate accurately? It sounds tricky.
It can be. The pretty standard method nowadays is transrectal ultrasound. We use specific formulas to calculate the volume.
Like length times width times height?
Sort of, yeah.
Oh.
The basic ellipsoid formula is length x with x height by 0.52, but we know that can actually underestimate the volume, sometimes by around 18%.
Oh, okay.
So there are more accurate formulas, sometimes called the bullet formula, using a different coefficient, like 0.65 or 0.66. Getting an accurate measurement is really vital for planning treatment.
Right, makes sense.
But even then, results can vary maybe 10-20% just based on technique or who's doing the ultrasound. For really precise measurements, sometimes 3D ultrasound or even an MRI is used.
Okay, so that's the physical size. But you mentioned another key number, PVR, post-void residual. What's that telling us?
Right, PVR. It's simply measuring how much urine is left in your bladder right after you've tried to empty it.
Okay, and what are the numbers we look for there?
So less than 50 milliliters, that's considered normal, good emptying. 50 to 100 milliliter might be acceptable, especially in older men.
What's that?
Then it gets more concerning. 100 to 200 milliliters suggests the bladder isn't emptying properly. And once you get over 200 milliliter,
That's bad.
that significantly increases your risk for things like urinary tract infections, bladder stones, even kidney problems over time because of back pressure.
Wow.
And if it's over 300 milliliter, that often signals that, urgent treatment might be needed.
And this is crucial because you might not even feel symptoms but still have a high PVR.
Exactly. That's the key insight here. PVR doesn't always correlate directly with how bad your symptoms feel. You could feel relatively okay but have a high residual volume that's silently causing damage.
Yeah.
It's measured easily with a bladder ultrasound scan.
Got it. So let's talk treatment. I know most guys start with medications, right? But when does surgery become the necessary step? Are there absolute triggers?
There are definite situations, yes. We call them absolute indications. The main one is acute urinary retention. That's when you suddenly just cannot pee at all. It's a medical emergency.
Right.
Also, kidney damage caused by the blockage, recurrent UTIs, bladder stones that keep forming because the bladder isn't emptying, or significant bleeding from the prostate. Those mean intervention is needed.
And what about less urgent but still necessary cases?
Those are the relative indications. Basically, when medications just aren't working well enough anymore and your symptoms are still really bothersome, significantly impacting your quality of life.
Like the getting up multiple times a night you mentioned.
Exactly. If you're getting up, say, 3, 4 more times every night and it's exhausting you, that's a major quality of life issue. Surgery might offer much better relief.
What kind of surgery are we talking about?
Well, the long-standing gold standard is TURP, transurethral resection of the prostate. That's where tissue is removed through the urethra. It gives about a 70% improvement in symptoms, typically. But there are also newer, often less invasive options now. Things like laser vaporization or enucleation, the Urolith system, steam therapy like Rezum, lots of choices.
So it really needs a personalized discussion.
Absolutely. It's crucial to talk with your urologist about your specific situation, your prostate size, your symptoms, your PVR, and figure out the best option for you.
Okay, so wrapping this up. BPH is, well, incredibly common, almost inevitable for many men. But the takeaway is you don't just have to live with it.
Not at all.
Understanding these variations, why accurate measurements like volume and PVR matter, it really does empower you, the listener, to take control.
It does. And if we connect this back to the big picture, getting symptoms checked out early can genuinely prevent serious complications down the road. It improves your quality of life as you age.
So don't ignore things.
Definitely not.
Thank
Talk
you.
to your doctor. Mention your symptoms. Ask about your prostate volume. Ask about your PVR. Explore all the options. Knowledge is key.
And maybe the final thought for you to consider, your prostate health isn't separate from everything else. It's a really essential part of your overall well-being as you get older. And knowing these details, well, that's always the very first step towards better health.